Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a very special transplant, that to multi-organ transplant surgeon, Dr. Sunil Shenve. And he has done his training, MCH and other training from the prestigious Postgraduate Institute of Medical Education and Research from Chandigarh. And after that, he was trained in USA and France. And more than that, he has done LLB and he has done MBA in finance. This is a very rare combination for any surgeon or any doctor for that matter. Today, he is here with us. He's a multi-organ transplant surgeon working in Sagar Hospital in Bengaluru. And today he is here to explain why the liver cancer occurs, how it can be prevented, and what are the causes and how to investigate. So welcome, Dr. Sunil.
Thank you.
Namaskar. Namaskar.
Thank
So
you.
please tell us what is this liver cancer and why people are still not aware and then dying. So please tell us what are the symptoms and how they present to you when they have the liver cancer.
So, liver cancer is a not very common disease, but we do see a fair number of patients with
Very often.
liver cancer. Why liver cancer doesn't get detected so often is because it is happening deep inside the abdominal cavity. So most of the cancers which are visible, which happen in the skin or face or over your legs, so generally they are easily visible, but something which happens deep inside cavities like abdomen or chest cavity or inside your skull, they are not diagnosed pretty early. Similarly, the liver cancers are not generally diagnosed at the early stage. Coming to what are the causes for liver cancers? So liver cancers generally occur in the background of chronic liver disease. Most of them are occurring in the background of chronic liver disease. Chronic liver disease is also called as cirrhosis of liver. So let us understand what are the causes for chronic liver disease or cirrhosis of liver. The most common cause is alcohol. So alcohol abuse is one of the most common cause of chronic liver disease. The other causes are hepatitis B and hepatitis C infection. And of late, it has been found that long-standing fatty liver disease can also cause chronic liver disease.
Okay.
Other than that, there are, especially young children, they will have inborn errors. They are born with congenital problems like Wilson's disease. All these patients can have cirrhosis, and cirrhosis will ultimately lead to liver cancers. But there are a small subset of patients where liver cancer can happen without underlying cirrhosis, and they are in patients infected with hepatitis B virus and the patients who have fatty liver disease, which is long-standing. So if you have a long-standing fatty liver disease or if you have a long-standing hepatitis B virus infection, you can also have liver cancer without developing cirrhosis.
Okay, very nice. You know, today I think you have many investigations by which you can detect. I'm talking about 30, 35 years back. My patient whom I had treated for MI, and then I had done angiogram, after many years he went to all the doctors, they couldn't make out. And he came back to me, and being a cardiologist, I palpated his abdomen. There was a big lump. And then, we detected that it was a liver cancer. So today, the advancement is there. Please tell our viewers, what are the investigations that are available and how that can be detected?
Now, nowadays, when the investigations, especially investigations like ultrasound, are very readily available, and most of the patients come to us with the ultrasound report rather than I ordering ultrasound. They already have got the ultrasound, and many of them have found out that there is something in the liver, and then they come to us. So whenever a patient comes to us, I told you that most of the liver cancers will happen in the background of chronic liver disease. So we generally order a couple of blood tests for them, liver function test, renal function test, PT-INR, and we also get viral markers to make sure that they don't have hepatitis B or C. There are some tumor markers test also like AFP. So these are the blood tests we do. If they are not done ultrasound, we will get the ultrasound done. The good investigations which are must to accurately stage the disease is either CT scan of the abdomen or MRI of the abdomen. And very rarely we do biopsy or PET scan depending on the situation.
Yeah, when you said the liver biopsy, I remember, when we were students 50 years back, such a big liver biopsy needle, we used to put and turn it and then to get a big chunk of a biopsy. But
Yes.
now no more. I think the CT and MRI can characterize the whole tumor and tell the diagnosis, I think. The
Yeah.
liver biopsies have come down much compared to
Yeah.
what it was in the past.
Yeah.
Okay.
Especially if the liver tumors are happening in the background of liver cirrhosis, the biopsy
Okay.
is not generally indicated. Based on the imaging
Okay.
only, you can diagnose something called as hepatocellular carcinoma. But there are very rare situations
Okay.
if the liver cancer is happening in without cirrhosis of liver. In that case, you may have to do
Hmm.
biopsy. And we also
Hmm.
have other tumors in the liver which may not be
Hmm.
cancer. In these situations
Okay.
also, we may need
The
biopsy,
benign
benign
tumors.
tumors.
Okay.
But of late, the need of liver biopsy is becoming less
Has
and less
come down.
because we have
Yes.
very good CT and MRI
Imaging. Yeah.
modalities.
Okay. And now, what are the symptoms that these patients they have when they come to you? And then how do you manage them?
Generally, symptoms, ma'am, as I told you, if it is incidental, they may not have any symptom. They go and get ultrasound done. There is something in the liver. They come to us. They may not have any symptoms. The symptoms generally are there if they have a underlying chronic liver disease. So if their liver is already failed, they will come with jaundice. They will
So
have,
the appetite is gone and then they are not able to eat and
yeah,
digest
they
and
will
all
come.
that. Okay.
But
Okay.
very rarely the tumor per se can cause problem. Like you just told us that there was a lump in one of the patient's abdomen, so it can
Hmm.
happen. The patient will come with loss of appetite, loss of weight, generalized weakness. So these are the general symptoms of liver cancer. Coming
Hmm.
to how to manage them, once we get
Manage.
investigation and we are sure that it is liver cancer only, nothing else, then
Hmm.
we start the treatment. Firstly, the best treatment would be to remove the tumor along with the part of the liver. So, if the
Okay.
liver cancer is in the right side of the liver, we remove the right part of the liver. If the liver cancer is in the left side of the
Right
liver, then
lobe.
we
Right
remove
lobe
the.
is removed completely. Okay.
So, that's the best treatment. But in many
Hmm.
situations, it may not be possible, especially in patients who are having underlying chronic liver disease. So, in
Hmm.
those patients, we have other modalities.
Hmm.
We can do transplant. If the liver is badly damaged and there is a tumor in it, then we can remove the whole liver and give a
Hmm.
new liver to the patient,
Hmm.
provided the disease is only in the liver and it has not spread anywhere else. That
Okay.
is one
Okay.
modality. The
Okay.
other modalities we have is intervention radiological methods, like you
Hmm.
insert a needle in the
Hmm.
tumor and burn the tumor. And
Okay.
we can also go
Hmm.
through the blood vessels and give chemotherapy to the
Hmm.
tumor. We call it as TACE, or you can also give radiation directly to the tumor. We call it as TARE. So these are
Yeah.
the things. And
No,
nowadays
that
we have,
this chemotherapy you mentioned, it's very important. In the past, when they used to give parenteral chemotherapy, there used to be lots of side effects and the people would never tolerate. Now, regional chemotherapy, that is keeping the catheter there and injecting only to the tumor, and that, reduces the side effects also. And I
yeah,
remember in one of the patients, that catheter had broken and it had embolized. So they had sent the patient to me. So we cardiologists are very expert in putting and removing the things from inside the vessel. So I removed.
yeah,
And
yeah.
apart from this chemotherapy and this electrotherapy, what are the transplant? Anything else can be done? Or
Yeah, nowadays we have,
can you prevent the whole disease? How can you prevent? Because
so
prevention is
prevention,
better than cure. So
yes,
instead
ma'am.
of spending lakhs of rupees and then suffering and whole family worrying about you, why can't we not prevent? How do you prevent
Yeah.
it?
The very good preventive steps, ma'am. First thing is you have to avoid getting chronic liver disease. And as I
Hmm.
told you, most common cause of chronic liver disease in India is alcohol. So if
Alcohol,
you
yes.
stop alcohol, you are unlikely to get cirrhosis of liver and you are unlikely to get liver cancer. So that's the most
Fatty liver
important.
also. Fatty liver also.
Yeah. So to avoid fatty liver, we have to have lifestyle modifications.
Yes.
We should avoid having a sedentary lifestyle. We have to do active exercise. We
Hmm.
have to have a balanced diet. That's the
Hmm.
way you avoid fatty liver. And
Yes.
then if you have to about the viral infections, if you have hepatitis B or C, you have to test yourself to make sure that you don't have hepatitis B or C. And if you have hepatitis B or C infection, you have to get treated for it. So that's the most important thing. Nowadays, in a national immunization program, all the children are getting vaccinated against
No,
hepatitis B.
as soon as the baby is born, the first thing given is the hepatitis injection and the BCG. And that's
Yeah.
how, the national program is so good.
Yeah. The people who are born before the introduction of hepatitis B vaccine, they have to get tested and take vaccine if they need it. Hepatitis C, nowadays we have very good medicines. So if you take those medicine for 3 months, you will be cured of hepatitis C, almost 99.9%. So that's about hepatitis B and C. And I told about lifestyle changes for fatty liver and absolutely no alcohol.
Okay, that's really nice. Is there genetic, I think, for cancer?
Yeah, most of the cancers which happen in the body, of course, have a genetic background, ma'am. So as I told, Wilson disease and many congenital liver problems predispose for cirrhosis and subsequently liver cancer. So we don't have a lot of intervention modalities now to avoid this. But if the patient needs transplant, then you change the liver, probably the risk of cancer will come down in those patients. But currently, we don't have a lot of interventions to deal with these genetic problems. But I am sure a lot of research going on. Subsequently, we will have treatment for these genetic problems so that the risk of liver cancers can be reduced.
But anyway, the incidence of that genetic condition is very, very rare. But what is more common is the alcohol consumption.
Yes.
So
Yes.
when we say that alcohol consumption, I remember a joke. A man who was totally liver, he had gone into the liver failure and then he started praying to God. He didn't ask for the liver transplant or liver. He said, if I have a next Janma, let me be born with the 32 livers, instead of, even if I don't have 32 teeth, it's okay. Let me have 32 liver so that I can drink much more, But that is not the way. The jokes apart, it is very serious matter because in Rigveda, Pancha Mahapataka, it is mentioned alcohol consumption is a crime. It is a Mahapapa. And in our constitution also, alcohol is banned. And in spite of that, people are consuming. They must think very seriously about their future and their liver.
Yes.
And without liver, they cannot. And liver transplant is so costly. And so it is important that they follow. And you very nicely mentioned that how you can prevent. Now immunization is there for all the hepatitis and that can be taken. And apart from that, the lifestyle you mentioned, and that is extremely important. If they have a regular exercise and take sattvic ahar and then avoid alcohol and then do not indulge in unwanted things, And what to say, like this junk food and all, do they have any impact on the liver? And the preservatives that is used as the taste enhancer, do they have any impact on the liver function?
No, ma'am, most of the junk foods are not balanced diet. So if you have junk foods, then probably you are likely to have obesity, and obesity contributes to fatty liver. So it is better to avoid junk food at all. Best thing is home food. Home food is the best thing. Don't eat outside. You never know what ingredients are being used outside.
Yes.
The best thing is to have home food and have a balanced diet and always calorie restriction. Don't eat too much, because if you eat too much, you end up having obesity or overweight, which leads to fatty liver, and do regular exercise.
Yeah, now we can see, you are a young transplant, that to multi-organ transplant, and you are so slim and trim. And I think all the younger generation should learn from you. And thank you very much for so beautifully explaining what is liver cancer and how it can be prevented and how the treatment can be given. Thank you so much, Dr. Sunil.
Yeah, thank you so much, ma'am. Thanks for having me.
Thank you.